on. Go ahead.
Good morning, Mr. Chairman, members of the committee, Sheila Bush with the Wyoming Medical Society. My comments this morning, I'll try to keep brief. We do oppose this bill, but it may not be for all the reasons that you think. Medicine is careful to take care of patients, and they believe strongly in individualized care. I think what we have with this bill is a sad example of when politics overcomes good policy. Good policy would include a collaborative effort from our medical professionals in the state and our surrounding regional subspecialists who are delivering this care and trying to do so in the most careful, slow, and deliberate way possible. Our Wyoming physicians have repeatedly told this committee and others, these procedures are not being done in Wyoming. We are not giving surgery. I think the words mutilated were used. Some very sad and concerning words have been used around this topic. And your own physicians in the state have told you repeatedly, they are not doing this to children. I think you can find YouTube videos, you can find social media, you can find examples of individuals like this incredible person to my right who have been harmed in other states. Good policy might have looked like working together and crafting a bill that maybe outlined the procedures and surgeries. I think we could have gotten somewhere really good together when medicine is involved, when they're included, and when they're not demonized. They're not monsters. They're just not. The pediatrician in the district of a member of this committee came forward and gave very compelling evidence. I'm not crying, it's cold, sorry. Gave very compelling testimony that he's doing everything in his power to do right by kids. Medicine is learning. It will change. They are doing their very best. And with that, I would stand for questions.
Questions, committee? Senator Bouchard.
Thank you, Mr. Chairman. If they're not doing it, then why would you oppose the bill?
Mr.
Ms.
Chairman,
Bush.
I believe I was clear in saying that if we had worked together, we could have crafted legislation that would have been specific to procedures and surgeries, which is what they have testified they are not doing. What is being done in Wyoming in rare circumstances and with careful consideration are puberty blockers, sometimes to give kids more time. As was testified earlier, these puberty blockers have been used for a very long time. They have experience with them, they understand the risks, and it is in an effort to do right by each individual.
Further questions, committee? Seeing none? Senator Dockstader.
Similar to what I asked the other day, as you work with your physicians across the state, would you say this is unanimous on their part? Their decisions, they actually come together and discuss this? Thank you.
Go ahead, Sheila.
Mr. Chairman, Senator Dockstader, I represent close to 1,200 physicians. I've never seen them agree on anything unanimously. It's just not a reality of my world. The way our process works is our board represents every county in the state. Each elected member of that county come to the state board and they bring the perspectives and positions of that county. When the Medical Society Board went through all of our bills for this session, there was not a dissenting vote on these policies. Yes.
And I would add to that, that you do have a letter in your packet from a physician that is a different opinion. So with that said, any further questions? Senator Hutchins.
Just a quick question about the Lupron. You said it's been used successfully. I know as in adult women, it's used sometimes before a hysterectomy. And I had a hysterectomy and I was put on Lupron and I developed joint issues. So I'm wondering with these little kids, are these below 18, have you noticed any joint problems or have you guys talked about joint issues with these young adults? And then I think the young lady testified before that she has joint issues right now. And then another instance, last week, I believe, in testimony, a doctor said, if we don't let them do these practices on another bill, similar to this one, he says, we'll leave Wyoming. So somebody wants to do this. Thank you.
Mr.
Go ahead, Ms.
Chairman,
Bush.
Senator Hutchings, so a couple of things in there. With specific to a medication, I am not a physician. I regularly let you guys know I have a piano degree and a philosophy degree, but it's not a medical degree. And so I won't speak to specific medications. What I can say is that with every treatment, whether it's a prescription for a medication or a treatment, there's always a balancing of risk and benefit, always. And that conversation is an individual conversation, and it's a conversation that belongs between a care team and a family. I will also offer that if that's ever abused, as has been testified to, that's malpractice. We have existing law against medical professionals doing wrong by their patients. Your second question. That was it, are you sure? I thought there was more there.
That was a very efficient answer.
Great, look at me.
Senator Bouchard.
I just want to comment on the malpractice. I mean, we just had someone testify that would have to go through a whole lot of hardship to go down that road. So I think, wouldn't you agree we're just slowing this down here, and they could do this at 18? I mean, that's kind of what we're doing here. It's not, we're not trying to say we're going beyond the scope of, hey, we're going to shut this down forever. We're just trying to stop it so when children are developing. I mean, wouldn't you say just slowing the roll isn't such a bad thing?
Ms. Bush.
Mr. Chairman, my testimony was exactly that physicians are trying to slow things. We just have different ideas about what that looks like. The testimony earlier is a very sad story, and I'll repeat, it's not a Wyoming story. It's the procedures and surgeries are not the recommended care. They are not the standard of practice. They are not being done in this state. And so that, again, if that's what this conversation was about, would look a lot different. It's not what this conversation is about. It's about all of what medicine is trying to do to learn and grow to care for these individuals in the best way possible. And this one does go too far.
One follow-up question.
One follow-up, Mr. Chairman. You know, I heard a doctor had testimony that she loved blood loss. That wasn't very compelling to your story. And to talk about this case that was in front of us this morning, it was in Nebraska. It was in a neighboring state. So it's not that far away. And hearing the doctor saying they'll leave this state doesn't convince me that there aren't people that want to go the route that Nebraska's doing. So that's, I just want to say that. I mean, if you want to add something, or I mean, it is kind of local to us. Wouldn't you agree that Nebraska is not that far away?
You can respond if you wish, Ms. Bush.
Mr. Chairman, I'm aware that Nebraska is a neighboring state. Thank you. I would say, I got really distracted with not knowing Nebraska was next door. It's local. Our physicians aren't doing this. They are slowing the process. In Wyoming, they are referred to subspecialists outside of state. Often, our patients are waiting on wait lists for up to 3 years. Through that 3-year process, or sometimes 4 years, they have to comply with a number of things with mental health and counseling and therapy. It's not quick. It's not, we had 2 visits and I had major surgery. If this bill were about procedures and surgery, we would be having a different conversation.
Make it a question if you would, and make it quick.
So, Mr. Chairman, you just said that they're going out of state to do procedures. My concern is a repeat of what we just heard, because that doctor isn't on the same page as what the page that I'm on. That doctor will still perform procedures in our neighboring state. So I think the sideboards we need to put up are a lot tighter than the ones you're talking about. So, I mean, wouldn't you agree that a patient could actually go through the same thing again? I mean, even, because we're not, without this bill, somebody who maybe disagrees with us could actually say, well, I'm gonna put somebody through the same thing that you just heard this morning. Because I don't see anything that says that we're slowing down, we're trying to slow it down. Where am I seeing that in writing? Where am I seeing that in testimony other than you? Other doctors said they would leave the state. So I want to know where those sideboards really are.
Respond as you will, but know that we have to move on to other testimony. We may hear some of that from other testimony, but go ahead, Ms. Bush.
Mr. Chairman, many policies being discussed this session are having a very chilling effect on medicine in the state. We have multiple medical students and residents saying, I won't come back here and practice if they want to make me a criminal for trying to do the best that I can and use the training that I've gotten. Those are real words. Those are true sentiments. I do feel compelled to quickly give some context around the comment, because it's been repeated so often from a physician of ours about blood loss. Physician humor is lost on many. It's taken me 17 years to really understand some of their humor. The intent of that comment was to say, as a surgeon, as someone who was wired to enjoy surgery, I don't recommend this. Her point was, of all the people who would come to you and say, yeah, let's do surgery, she would be eager to go to surgery because she enjoys that process. She enjoys healing in that way. And it's a very necessary component of healing. Her point was, I'm good at it. I was wired to do it. And I don't think this is a good idea. When taken out of context, it sounds alarming. When put in context, it's making exactly the point that you all are also making. And I think we have to be careful to not weaponize words of our own people in the state. Maybe it was an ill-timed joke. Okay. But she wasn't making any more of it than that.
Okay, let's go ahead and move on. Go ahead, ma'am. Introduce yourself. I think we recognize you, but introduce yourself anyway.
Thank you, Mr. Chair. Thank you, committee. My name is Sarah Burlingame, and I'm the Executive Director of Wyoming Equality, and we are in opposition to this bill. So I've been in my position for the last 7 years, and as the director of a statewide LGBTQ advocacy, we field a lot of phone calls from parents of transgender children. And in the last 7 years, I have never received one phone call, email, or text saying that they needed surgery for their minor child. It just hasn't happened. We have received hundreds of text, Facebook messages, emails saying, how can I best support my child? And we also run a support group for the parents of transgender children. And for a year or two, I got to facilitate that. And I wish everybody on this committee had the opportunity to listen to those parents and hear their concerns for their children. Not only were none of them centered around surgery, but they were incredibly mundane. They were the things that everybody worries about for their children. They really worried about them fitting in. They worried about their interactions with their peers. They worried about locker rooms. They worried about bathrooms. They worried about lunchtime and recess. They worried about all the things that all parents in Wyoming worry about and want for their children. They had the added wrinkle of also worrying about their child's gender presentation. And it really ran the gamut. Some of these kids went into kindergarten in Wyoming schools presenting as the gender opposite from the sex that they were assigned, and were immediately brought in by their teachers, by their peers, and had great experiences. That's not the word I'm looking for, but it's gone. And others had really tragic and wretched, experiences. And so facilitating this group for parents of transgender kids, we talked about all of those. And that is a thoughtful process. And that is one that I think isn't entertained, unfortunately, in bills like these. The other process that I think reflects Wyoming's best efforts was the Wyoming Medical Society had a conference this last summer, and it was an opportunity to talk about gender-affirming care. And there were two parts of the conference. The first part was clinical, which I can't really speak to because I don't even have a degree in piano when it comes to medical things. But the second part was about policy. And the conversation that we had there encompassed people from people who thought that no kind of gender-affirming care should ever be acceptable to minors, to people who made it their life's work to offer gender-affirming care. And what we had was a thoughtful conversation. What we had was something where we didn't demonize each other. We didn't assume that someone was trying to harm children and someone was their salvation. Instead, it was a conversation that recognized that these are real Wyoming families. They are struggling to understand how to best serve the needs of their children. And if we have a place where those conversations can happen, and if we have bills where the medical community is brought in and we say, hey, we think that things that like happened in Nebraska are terrible, are a tragedy. How can we make sure they never happen in Wyoming? We stand ready to support any legislation that would give us that process, that would give us those outcomes. But this is not that, and we would really ask you to reject this proposal for what it is. And I'm happy to stand for any questions.
Thank you, Ms. Burlingham. Questions, committee? Seeing none. Thank you for
Thank you,
coming.
Mr. Chairman.
Let's move to the other end of the table.
Mr. Chairman, Bill Winnie, Sublette County. I have some experience during my time on active duty in the Navy that may shed some light on the needle you're trying to thread. The Navy and other armed forces have alcoholism programs. And I saw one young man drawn into it labeled a, quote, dry alcoholic, unquote. I thought that odd. I let the process work its way through, talked to the young man a few times. At the end of the process, it goes about a year or so, I finally concluded that he had been drawn in. He never really had a problem. And so that's kind of what you're trying to figure out here is how do you get from those who might be drawn in. Some 2 or 3 decades ago, this nation went through a period of hysteria where child care centers were accused, the adults at child care centers were accused of demonic and depraved activity with children. It finally ran its course. And they finally concluded that it was projection by some other adults. So you're trying to thread a needle here between those very, very few children who might truly be at issue and those who could be drawn into irreversible actions. Subject to your questions. Thank you.
Questions for Mr. Winnie? Seeing none. Go ahead. We got 2 empty seats for anybody else that's going to come up. Please come join the seats. Go ahead, sir.
Thank you, Mr. Chair, members of the committee. My name is Tyler Sesser. I come to you as a concerned parent, as the husband of a breast cancer survivor, and as a friend to people with developmental disabilities that I've grown up around and heard kind of stories that this bill might affect them as well. So as a parent right now, I'm looking forward to the future my daughter might have and the options that are there for her. And I'm hoping that there's growth in the medicines available so that we see less side effects. I'm really hopeful that we can see that. And I'm proud that we have a process that we can engage in that it's not outright outlawed so that we can't explore and figure out how to do this work better. My concern, but also my gratitude to Senator Burchard about your willingness to explore the amendment for the exemption for the puberty blocker at the early age. That's kind of where my concern is now. I think there's more exemptions that we need to consider. I think they've been brought up by other speakers. The one that comes to mind for me is a lot of parents of children with developmental disabilities rely in part on puberty blockers and hormone therapies to to extend the body change process and to kind of provide them some time to navigate that. They also rely on some for the prevention of unwanted pregnancies in teenagers with developmental disabilities. This bill, I think with a similar concern that we heard earlier this morning, might create fear amongst providers and fear amongst parents of how to navigate that. But just as gender transition and gender affirming care is a complex conversation, so is that. There are a lot of people with developmental disabilities who talk about self-advocacy and bodily autonomy, and we're exploring that within that community. But that conversation with this bill is halted and said that exploration is illegal and will prevent them from having access to those medications that improve their quality of life. For my wife, as a survivor of breast cancer, she was diagnosed early, and we've been together. In March, we've been together longer in life than we weren't. So it'll be 18 years together. But she was diagnosed early on with the BRCA2 gene. And later in life, after she turned 18, she had access to tamoxifen and medication that reduced estrogen. But what happens if my daughter gets diagnosed and maybe there's an advancement in the medication that could prevent her from having breast cancer later in life, and that hormone therapy is seen to be effective within teenagers? Will this bill prevent my daughter from accessing the care that she doesn't have to go through what her mother had to go through? So with that, I'll stand for questions. I feel like these amendments are too great for us to accomplish today. I encourage you to vote no on this bill. Thank you.
First of all, congratulations on 18 years. That's very cool.
Thanks, sir.
Questions, committee? Senator Bouchard.
Thank you, Mr. Chairman. So this bill is geared for one thing. It's not for other treatments, other hormone treatments. I mean, have you read the bill? It's very specific. And back to the puberty blockers, there are some drugs that are being used for the same, for puberty blocking, that they really haven't, they don't know the long-term effects. And so some of that experimentation is detrimental. So you do understand that so two questions. One, you do understand that this bill only affects one procedure that with sex change and to minors. And the other thing with puberty blockers there are a lot of experimentations going on. This bill is not going to affect that, but also understand there are dangers. And do you understand that?
Go ahead,
Mr.
sir.
Chair. Thank you, Mr. Chair, Senator Bouchard. So under subsection B, remnant number 3, I believe that some of that language and elsewhere in the bill creates reasonable concern and fear that this would apply to that medication. As someone who's worked with the developmental disability community for close to 2 decades, that I can share that I think this will cause concern in whether or not the parents will be criminalized. Children with developmental disabilities also have sexual orientation and gender identity, so this might affect them in a way that we are not aware of yet. And to your second question, I'm acutely aware of, as I said, my wife went through and was on tamoxifen, and we've lived that life. But what I do know is that because of her experience, there were great benefits to the medication that she took, and there's been great advancements since the time that she started taking those. If this bill passes, it prevents any future advancements because we cannot explore the efficacy of these medications. I'm not a clinical person. I also have a music degree. I'm a saxophonist, and but I've spent my life with a lot of folks that have experienced this firsthand. Thank you, sir.
Good. Should have brought the saxophone. Okay, let's
We
move
can
on
bill
to
you.
we're going to move on to the guy with the best tie in the room. Welcome to Labor and Health Committee. Is this your first time in a committee?
Yeah, it is.
Well, welcome. That's the hardest part, is getting that green light to come on. Go ahead and just tell us your name and tell us what's on your mind.
Thank you, Chairman. My name is Chris Folsom. I'm a graduate student at University of Wyoming, and I've also graduated from University of Wyoming with a physiology degree. And I've also done physician shadowing under doctors who provide gender affirming care. That wasn't in Wyoming, but in Colorado. And I just want to say that I have personally, I want to speak specifically to puberty blockers, because that's the only thing I've personally seen prescribed to minors in these situations. And just that I firmly support the use of puberty blockers for minors. I've seen it save lives. And I think in a state with one of the highest suicide rates, it's something that should really matter to us. And puberty blockers, the chief form of gender-affirming care provided to minors, has been in use for decades in a variety of contexts, precocial puberty, certain cancer patients that many other people have testified to, and it has been proven safe. I can't speak to every specific puberty blocker about new ones that have arisen, but there are ones that have been on the market for decades that have been studied and proven safe. And I would just like to say that I think the banning of puberty blockers, in particular for minors, goes against the advice of the American Medical Association, the American Psychiatric Association, and every other scientific body that I've personally read the opinions of on this matter. And I would just like to encourage legislators to just defer to those opinions of experts. And I believe that is the majority opinion of medical experts in the field. That's all I'd like to say. Thank you.
Nope, thank you. That was very good, Chris. We appreciate that testimony. Okay, any questions?